Hello, everyone. Welcome to Cracking Addiction. My name is Dr. Fergal Armstrong, and once again, we've got Dr. Laura Petracek with us. Laura, I thought we'd continue our discussion on the 12 steps by looking at the second step. Can you tell me what that second step is?
Yes. The second step, Fergal, is came to believe that a power greater than ourselves can restore us to sanity.
Now, there's a lot in there, isn't there?
Yeah. Step two is the one that gives us hope.
That's actually how I memorize the steps. I have key words, and my word for step two is hope. But when I hear you say that, I hear three statements. I hear came to belief in a power greater than myself, and the restoration of sanity. So let's talk about each of those in turn. So came to believe, what does that mean in the context of recovery?
So came to believe is three words. Came to believe. And the first word came talks means attending meetings. So we're attending meetings, we're coming. We're attending. And then came to means we're waking up. The cobwebs are coming out of our mind, where our body is detoxing off all the chemicals, the alcohol. So we're starting to have a clearer mind. And then came to believe is just that, after attending a lot of meetings, after being sober for a while, then we're coming to believe in a power greater than ourselves. And that power could be the group of drunks, God, or the great outdoors, God, or it really could be anything or anybody. It doesn't have to be a deity or a god or any sort of religious figure, because unfortunately, that premise keeps a lot of people away from getting recovery, which is uh, a shame.
Yeah, so there's a lot in there. So came, I mean, I say to people that going to a 12-step program or going to a peer support program is like going to the gym. You can go to the gym 5 days a week and you can have a latte, have a salad followed by a sticky bun, and maybe put some sweat clothes on and walk around and say hello, and then go to the steam room in the sauna. And you can go to the gym and just not do the work. And it's the same with the 12-step program. It's not for me. It's not just about going or coming to
Yeah.
a meeting. It's also about actually working at that meeting. And I suppose that really can be thought of as coming to, isn't it? You've got to come to the realize that you've got to wake up to this idea that you have to engage.
Yeah. No, I think that's a very good point. Sometimes in the rooms, I hear the phrase, the steps worked me, and I don't agree with that. The steps don't work you.
Hmm.
You have to work the steps, you know.
Right.
So that to me is a cognitive distortion, as it were.
Mm.
Like you stated,
Mm.
we need to do the work. You can't just show up. And some people do for years, and I've heard them talk later. They just showed up and then left. They didn't get a sponsor. They didn't do any of the step work. They didn't do any of the work. And they didn't really get a lot out of it. Like you were talking about the analogy of the gym.
Yeah.
So,
Yeah.
yeah, we have to do the work.
The other statement that I've heard is that if you go to enough meetings, if you come to enough meetings, eventually you will hear what you need to hear.
I think that's true for a lot of people. For me, a lot of what I needed to hear was more out of therapy. In therapy sessions, I feel like I got more of what I quote unquote needed to hear in therapy than in 12 step, although there are things I've heard in 12 steps. But so I think it's both places, not just 12 steps.
And if we move on to this belief in a power greater than yourself, You're absolutely right. You know, there is this connotation, or this religious connotation in the belief in the higher power, which for some people can be off-putting. But I liken it to an accountability to something or someone other than yourself, because I think accountability is one of the key things that will continue to make you get up in the morning and follow your journey of recovery.
I like that idea. It does make us accountable. You know,
Mm,
that it's not, and it's also kind of ties back to, I mean, something I've heard in the room for years, and I do agree with, is that you don't have to do this alone. And I really don't
mm,
think you could do it alone. And that's where
yeah,
a higher power is where we're
yeah,
accountable, as long
yeah.
as well as to the group and our sponsor and to our families, ourselves.
I had the story of a patient who had a bottle of HP sauce at the bottom of their bed, and HP was their higher power. So it really doesn't actually have to be anything based on the belief in any God according to any major religion. But then again, there are people that do have a faith. There are people that do have a faith, and they do value this concept of God.
It's our own personal choice. I think it's unfortunate, or, maybe because it was written 80 years ago, the steps really refer to a Christian white male God. Um, and I know people who are Jewish or come from other religions, that is really off-putting. Like, they're saying this is so Christian. It's just a turn off to me. So, but it doesn't have to be. The power grader could be the HP sauce. It could be the HP printer. It could be it could be a doorknob. It could be whatever you want it to be, you know,
Yeah,
or whoever you want it to be. So, uh, but and then there's a lot of meetings for agnostics. It could also be
yeah,
you don't believe in a higher power at all, and that's okay. You could still get sober and stay sober. It
yeah,
doesn't have to be a deal breaker.
yeah. But it's not about, it's about accountability, isn't it? It's about, we've said in a previous episode that it takes a village to engage in recovery. And really, it's about acknowledging that it does take a village.
It does take.
You cannot do it on yourself. There are no lone rangers in recovery.
Well, there are, but I don't think they make a lot of traction or a lot of progress. I mean, there are people
Mm.
that quote unquote put the plug in the jug and call it a day. Or I even have some clients who said, I don't need AA, I'm just going to stop drinking. And, yes, indeed, they've stopped drinking, but I've, kind of showed them or given them feedback that not a lot else has changed. So just not drinking is just really the first half of the first step. You know, it doesn't
Mm.
refer to the rest of the 11 steps. So a lot of
Mm.
people think that it's a misconception that, oh, okay, I just don't drink, and it's okay. No, there's the program. The 12 steps are for a reason, for change. Just not
Mm.
drinking. Most people don't change, and actually, a lot of people get worse in terms of irritability, discontent, kind of a sour mood. Yeah.
So, is that the concept of the dry drunk?
Yes, I would say that's the concept of the dry drunk. Exactly. You're just hanging on by your fingernails, and you're not drinking, but it's like you're drinking because your behavior hasn't changed.
So let's move on to the last third of the statement, the restoration of sanity. What do you think about that statement?
I used to have a lot of trouble with this statement, in that
Mm.
also being someone who has a mental health issue, I also have bipolar disorder. So when I read the last part of the statement, I'm like, oh, well, okay. People already have this stigma that if you have mental illness, you're insane. at least back in the day when I got clean and sober. So I see sanity as soundness of mind. So I reframe that word to work for me and to fit better because sanity, I mean, because it alludes, like it states, that we were insane, we were drinking. And, but if you have mental health issues and stone cold sober, there could be some insanity type behavior there too. So again, but I don't like the judgmentalness of it, and therefore I like the phrase "restore us to soundness of mind."
I can look at that phrase in a number of ways. One way that I look at that is the this concept of mens sana in sano corpore. So really, it's all about health. So a healthy mind and a healthy body. So the restoration of health, you could look at the restoration of sanity as the restoration of health. Which, and when you consider the physical health effects of, and then the hazardous effects of alcohol, there's a whole raft of health benefits in abstinence. And that includes the reduction in the risk of cancer, liver disease, heart disease.
Also, reduction in mental health issues.
Well, that was the second point. Another way of looking at it is to actually say that this alludes to this pervasive concept of dual diagnosis, where we do know that people with a substance use disorder are very commonly also suffering from a mental health disorder. So it's an acknowledgement of that dual diagnosis.
Exactly. And yes, a lot of people in the
Mm.
rooms also have suffer from dual diagnosis.
So, did you find this statement when you were starting out in your journey? This concept of the restoration of sanity. Did you find that difficult to engage with?
I just, honestly didn't relate to it. I think is the way I kind of went around it because I didn't, again, I thought that precludes that means I was insane, and I didn't
Hmm.
really, buy that. And I mean, I was very young when I got clean and sober, so a lot of my drinking, there were a lot of yets, quote unquote, and I didn't experience those. So when I'd hear in the rooms a lot of insane behavior, I thought, that's definitely not me. So I, had to couch it in a different way that I could more relate to. And I remember hearing in the rooms once someone said soundness of mind. And I thought, oh, that's something I could hang on to. That's something I could relate to.
Tell us about the Yets.
Well, the Yets, getting a DUI, um, losing your home, your job, and your family. I mean, I was 17, so I didn't have any of those yet when I came in the rooms. Well, I did have a job actually, and I didn't lose it. So, that, was kind of a way I would show, "Oh, I don't have a problem," or I was a straight A student. So, "Oh, drinking haven't really affected me because 'cause I'm still getting straight A's." So that was a way that fed my denial.
Yeah,
Yeah,
yeah, yeah, yeah. So when I hear you say "yet," I actually hear denial.
yes,
And I have a I'm reminded of a number of patients that say to me, "Oh, look, I'm not like them. I don't really have that much of a problem. I don't need to attend a peer support group."
right.
And there's another barrier that I hear is that my suffering is unique. No one else will understand my journey, my pain, my suffering. So therefore, there's no point in going to disclose my suffering to a bunch of people that won't comprehend it. And that can be a significant barrier. And I find it quite challenging to try and help people when they're in that mindset. What would you say to that?
Yes, I think that is common. A lot of people feel they can't relate to the other people in the rooms.
Mm,
and or that their story is different from the other people's story, which it is.
mm, mm,
Um, so I suggest to someone, instead of comparing stories, uh, try to instead identify with the feelings. What are the feelings that the person's that's sharing? Despair, hope, uh, sadness. What of those feelings that they're talking about can you relate to, identify with? So, because it's a way to keep separate, right? When someone says, well, the phrase is terminal uniqueness. I'm unique,
yes,
you know,
I like that terminal uniqueness.
it's
Yes.
a phrase in the rooms. And when we get in that space, that prevents us from being or joining the group because my story is so different from yours. So I don't know how you could help me.
Yeah.
Um, but if you could
Yeah.
identify instead of comparing, that's what I keep suggesting to people. Or for folks that have, more mental health issues or mental health issues, I also suggest trying some dual diagnosis groups. But
Mm.
I want you to try at least 6 different meetings before you say, Dr. P, none of them. They're all a no. I want you to try at least
Yeah.
6 and 6 different ones.
I really like this idea that instead of focusing on the differences in your story, focus on the commonality of the feelings, because it reminds me of the fact that every organ system in the body only has a limited number of ways of expressing pathology. And I suppose if we consider the organ of our soul that makes us suffer emotional, pain, there are only a limited number of ways that we can express or feel emotional pain, and yet we have a myriad of unique journeys towards that expression. So it really does actually narrow the focus down away from our individual uniqueness towards this commonality, this common bond of suffering, doesn't it?
Yes, it does. It
I really like that. Yeah,
Yeah, thanks. Yeah, and it
yeah,
also helps then us feel less alone, and gives people or helps people feel more hope.
yeah,
Yeah.
yeah.
When
So, do you think that this concept has stood the test of time and resisted the charge of being stigmatizing?
I think it has resisted the test of time, but I
Hmm.
do talk in my book about my own story and how I struggle with this last third of the second step, how
Hmm.
I came to view it differently to help me work the step in its entirety.
Yeah, and it's okay to rework the step, the literal words of the step, and to actually adapt the words to serve you, isn't it? It's not a religious text.
Exactly.
It's not sacrosanct.
No. Although a lot of people in the room see the text as sacrosanct, and that is, of course, I feel an issue because it leaves people at the door that would maybe otherwise come in, which I think is a shame. Yeah,
Yeah,
yeah.
and that opens the door to the internecine conflict between all within and between all religions, doesn't it?
Yes.
This idea that one particular interpretation is the inherent truth. I don't believe that the 12 steps as it was written in the 1930s is the entire manifestation of the inherent truth of recovery.
Yes. I agree because we have 80 years since then and 80 years of research and otherwise to build upon those 12 steps
Mm,
or to
yeah.
flesh them out more. Yeah.
Mm. All right, Laura, we've run out of time, but I want to thank you for your expertise today, and I look forward to discussing with you again shortly the third step in the 12 steps. Many thanks. That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.